Hello everybody, I am Dr. Ataur Rahman, consultant internal medicine. Today is World Diabetes Day. 100 years ago, this day, insulin was discovered by a scientist in Canada. Today, millions of people are benefited by insulin. However, don't think that insulin is the way to go. First of all, you have to know that diabetes, hypertension, and many other diseases can be prevented by diet and exercise. In diabetes, 50%. In diabetes, there are two kinds of diabetes. One is diabetes type 2, type 1, another is type 2. Type 1 diabetes, 95% people are diabetes type 2. They require medication if their sugars are not controlled, the oral medication or insulin. But type 1 diabetes is absolutely dependent on insulin. Without insulin, the type 1 diabetic patient may die in a year or so. Type 2 diabetes is mainly, there is no cause established. However, it is thought that it has genetic predisposition. Those whose father and mother is diabetes, the patient can inherit diabetic gene from their parents. If both of them are diabetes, there is a likelihood of 100% chance that the child can be diabetes at their third decade of life or more. By and large, weight loss and diet control can prevent diabetes, type 2 diabetes mellitus. If you prevent type 2 diabetes mellitus, then you prevent degenerative joint disease, you prevent coronary artery disease, you prevent hypertension, you prevent dyslipidemia, you may prevent heart attack and stroke. Significantly benefited by losing weight. You have to set a line, set a target that you cannot be too fast. 1 to 2 pounds a week, 30 minutes of brisk walking, biking, swimming, jogging, or any kind of aerobic exercise, 30 minutes a day and at least 150 minutes a week can be significantly beneficial to you. If you have a family history of diabetes, it is imperative that you take care of your health from childhood. Avoid junk food, avoid sugary drinks, try to eat a lot of fruits and vegetables, whole grain cereal, low fat milk. Do not consume any shell food like hot dog, sandwich, or anything in the can present in those who are abundant in the supermarket in the United States of America, North America, and also Europe. They are not good for your health. These foods are rich with saturated fat and also trans fat, which is enemy to your heart. If your parents are diabetes, remember that you are at risk for diabetes. Therefore, diet and exercise should be the first line of treatment, even you are diagnosed with diabetes. But if you have a high sugar or borderline sugar or pre-diabetes or pre-hypertension, your best bet is to lose weight, is to do exercise, is to stick to diet and exercise and indulge in good habit. Do not smoke cigarette or any nicotine product. Do not drink at all. If you drink, drink in moderation. Do not drink any juice, sugary drinks, or any soda cola. Please drink a lot of water, eat a lot of fruits and vegetables, and eat fish 3 times a week. Seafoods are good for you in moderation, and it is good for your heart and it is good for your brain. Those who have diabetes, they have a multiple complication, retinal infarction, blindness, heart attack, stroke, peripheral vascular disease, heart attack, heart failure, and they have a risk of degenerative joint disease and arthritis, and also some kind of cancer. In order to prevent all kind of complication of diabetes and diabetes, you have to prevent in first place diabetes, and prevention is better than cure, and prevention begins at home. As we say, charity begins at home. You start eating healthy food and nutritious food which are abundant in the nature. The vegan and vegetarian people deserve salutes from me because they love the nature, they protect the nature, they protect our environment, they think the food security of the world, they love the animal kingdom, that they don't want to kill the animal to eat. And if we can eat fruits and vegetables in exchange of meat, if we can eat fish in exchange of red meat, it is good for our health and good for our society, good for our planet. Please let us promise from today, World Diabetes Day, we are not going to be affected by diabetes. Most of the diabetes people, even they don't know they have diabetes, like most of the hypertensive people, like in the United States of America, 50% people, those who have hypertension, 50% of them, they do not know they have diabetes, they have hypertension. In the country where I live, 75% people, the diabetic, those who are diagnosed with diabetes, more than 75% people are not controlled. Even 50% of people, they are unaware that they have diabetes. Therefore, we have to start doing some exercise and stick to diet and exercise, diet and exercise, diet and exercise, and stay healthy and free from diabetes and its complication. Thank you so much. See you.